1. I know this is a lot to take in, and I understand how worried you must be. 2. First, let me assure you that Noah is in good hands, and we're going to do everything we can to make sure he comes through this safely and successfully. 3. An ASD is a hole in the wall between two upper chambers of the heart. 4. That hole should not be there. 5. Noah's heart has been working harder because of this hole. 6. But fortunately, it's something we can fix. 7. The procedure we're going to do is called surgical ASD repair. 8. And it's a routine operation with very high success rates, especially for children as young as Noah. 9. We'll need to do open heart surgery, but I want to assure you this is something that we've done successfully many times. I myself have successfully performed this operation over 200 times. 10. The surgery itself will take about 3 to 4 hours. 11. During the procedure, we'll use a heart-lung machine to take over the function of Noah's heart while we work on it. 12. This allows us to carefully and precisely close the hole in his heart. 13. The good news is that most ASD surgeries go very smoothly, and the vast majority of babies like Noah recover beautifully. 14. Complications are rare, and we will closely monitor him every step of the way. 15. Even though risks are uncommon, I do want to go over some of the risks associated with any open heart surgery. 16. One of the primary risks we monitor for is infection. 17. Anytime we perform surgery, especially on the heart, there's a risk of infection, either at the incision site or internally. 18. We take every precaution to minimize this risk using antibiotics. 19. Maintaining a sterile environment. 20. And closely monitoring his wound after the surgery. 21. Infections are rare, but if they do occur, they're typically manageable with medication. 22. Another risk involves bleeding. 23. During surgery, there's always the possibility of more bleeding than expected. 24. If this happens, we are prepared to control and treat it. 25. We will be monitoring his blood flow during and after the surgery. 26. Finally, sometimes the heartbeat might be irregular for a short time. 27. If it happens, we treat this with medication and it usually resolves quickly. 28. Please remember that the chance of serious complications is very low. 29. The vast majority of children fully recover, just like we expect Noah to. 30. After the surgery, Noah will spend a few days in the NICU so we can monitor his heart and make sure everything is healing properly. 31. After that, he'll likely spend about a week in the hospital. 32. Babies are pretty resilient, and he should be back to his normal self within a few weeks. 33. We'll continue to follow up with you to make sure everything is on track. 34. With a successful repair, Noah should be able to live a full, healthy life with no restrictions. 35. Once the defect is closed, his heart will function normally, and he won't have to worry about this in the future. 36. Of course, we'll continue to see him for regular checkups to make sure his heart remains healthy, but after the surgery, we expect him to thrive. 37. I know this is a difficult time, but please know that our entire team is committed to taking excellent care of Noah. 38. We'll be with him every step of the way, and we'll make sure you're updated throughout the process. 39. You're part of our team too, and we're here to support you. 40. Dr. Kapoor is the anesthesiologist who will be with Noah the whole time. She will come talk to you as well and answer any questions you may have about anesthesia.